What is the unmet need for people living with inflammatory bowel disease today, here, April 2025? Here are my 7 top unmet needs. First, we need to raise awareness. Still, we've done great work for this in the last 10 years, but much more still to raise the awareness in all regions across the world. 2, we need to ensure equity of care. That means the same level, high quality, compassionate care to every person living with inflammatory bowel disease, wherever that they are in the world, whoever they are, whatever age, sex, ethnicity, whether they're rich or poor, etc. Third, we've got to try and break the therapeutic ceiling. We are, I think, already doing this. Earlier therapies get better outcomes. Using newer therapies, when we use them head-to-head compared to some previous therapies, we're seeing better outcomes. Yet, we're still a bit stuck. 30 to 40, maybe up to 50+% mucosal healing at a year. We've got to get much better than that with new, more targeted therapies, with new therapeutic strategies, with combinations and much more. Fourth, we need frictionless, passive monitoring systems. The current systems that we have are fine, except they're either invasive or even the non-invasive ones have to be delivered by an expert, such as intestinal ultrasound, or have a certain FAF factor, like collecting stool for fecal calprotectin. There's much more that we can do here, and I think we are on the cusp of being able to do this with existing technology and with new predictive algorithmic models. Fifth, moving on from that, stratifying patients. How can we deliver precision medicine for IBD? Can we get the right drug to the right person at the right time and at the right cost to society? Can we work out who is going to have aggressive versus quiescent disease? And can we factor in who is going to get the complications of both the disease and of the drugs that we use? Number 6, strategies for holistic remission. We need to think, and we're getting much better at thinking, beyond the gut to the extraintestinal manifestations of IBD, the psychological manifestations of IBD, thinking about sleep and other behaviors such as diet. But we have a lot more to do here to deliver this to every person with IBD where they need it. We need more resource, we need more infrastructure, and we need much more data about how to do this properly. And then finally, number 7, we need a roadmap that leads to the prevention and ultimately to the cure or cures of Crohn's disease and ulcerative colitis. And we are, I think, starting to see a roadmap to prevention emerge, with studies looking to not only identify those people at highest risk, but then intervene to prevent the disease from occurring. We will see that start to happen soon. But to prevent IBD overall in the world that is going to have 150 or 200 million people living with IBD in the next 50+ years, that's a big challenge for us. So not an exhaustive list, but 7 things: awareness, equity, break the therapeutic ceiling, frictionless passive monitoring systems, stratification, holistic remission, and a roadmap to prevention and cure. Those are my top 7 unmet needs for IBD in April 2025. What are yours? Let me know and we can discuss. Thank you.